Welcome to my channel. During pregnancy, the baby's position is very important. Whether a normal delivery or a cesarean section will be required depend on the baby's position during pregnancy. Whenever an ultrasound is performed during pregnancy, the position of the baby is noted in the ultrasound report. The ultrasound report might indicate the baby's position as cephalic presentation, breech presentation, unstable presentation, unstable lie, transverse lie, etc. What do these terms actually mean? What do they signify? And in which position is normal delivery possible? In today's video, I will discuss how to understand your baby position by looking at the ultrasound report. Will you also talk about which position can be cause for concern? So let's get started. Number 1. Cephalic presentation. Typically during pregnancy, the baby's head is positioned downward, which is the face turned toward the mother's back, also known as posterior cephalic position. This is normal position of the baby is referred to as cephalic presentation in medical term. Look at the picture. These images show the screen present cephalic presentation. If your ultrasound report mention a cephalic presentation, it means your baby is in the normal position. Number 2. Breech presentation. If your ultrasound report mention breech presentation, it means your baby is in upside down position, meaning the baby is not in the normal position. In a breech presentation, the baby's head position upward or baby in transverse position. Sometimes the baby head may be down, but if the eyes are the first present to instead of the top of the head, it is called brow presentation. Breech presentation can occur in various forms such as complete breech, frank breech, transverse lie, among others. Typically the baby in a longitudinal position, but if the baby is a transverse position, a normal delivery becomes very difficult. Look at the image. In the other word, any position the normal position is referred to as a breech presentation. Number 3. Unstable lie or unstable presentation. In some report, you may find the term unstable presentation or unstable lie. The term lie typically refer to the orientation of the baby's spine. During pregnancy, if the baby's spine is aligned with longitudinally with the mother's spine, it is called longitudinal lie, which is normal. However, sometimes the baby's position shifts side to side crossway, which referred to as an unstable lie or unstable presentation. Simply put, the baby's position is not fixed. Why does this happen? It is commonly observed between the 3rd to 8th month of pregnancy because during this time the baby float in a fluid-filled sac called amniotic fluid or liquor. Between the 3rd to 8th month, the baby is relatively small compared to the size of the mother's belly, allowing to the easily change position. Additionally, this report can occur in mother who have excess amount of amniotic fluid, a condition known as medical term as polyhydramnios. This condition can also occur in the case of multiple pregnancy or when carry twins baby. Number 4. Transverse lie or transverse presentation. This is a type of breech presentation. If your ultrasound reports indicate that your baby is transverse lie or transverse presentation, it means your baby is positioned sideways. Now you might wonder what problem could arise if the baby is not in the normal position. Here is an important point is noted. If an ultrasound report is from 35 weeks or earlier and you see the baby is not normal position, there is no need to worry. At this stage, the baby is still small enough to move into the normal position at any time. However, even if the baby in the normal position before 35 weeks, this is no need to excited, as the baby can still shift into an abnormal position. For this reason, it is crucial to have an ultrasound after 36 weeks of pregnancy. This will give you a much clear idea of whether you likely have a normal delivery or if a cesarean section might be necessary. Many people comment and message me asking how to correct the baby's position if it is not in a normal position. To answer this question, there is something important you need to understand. Between 34 to 38 weeks of pregnancy, the baby typically gets into the position for delivery. That means from around 34 weeks, the baby usually brings to move into the cephalic presentation, head down position, and by 37 weeks, the position generally fixed. Delivery usually occurs between the 38 to 42 weeks. Normally, during pregnancy, the baby is inside a fluid-filled sac called amniotic sac, and the fluid inside the known as amniotic fluid. Since the baby is floating in this fluid, it can easily change the position. At this stage, because the baby is still relatively small and constantly moving, it can change their position at any time. Even if you ultrasound at 34 to 35 weeks show that your baby is in breech presentation, there is still about a 50% chance that the baby will move into the normal position on its own. However, if you have ultrasound at 36 weeks or later and find the baby is breech presentation, this can be cause for concern. A breech position at this stage make normal delivery risky. In such a case, you should prepare the delivery in a hospital. Another important point to be noted that there is no medication or supplement that can be changed the baby's position back to normal. There is also no specific exercise that can guarantee the baby will move into the correct position. So, if someone assures you that the medicine or exercise can change the baby's position, there no need to believe it. If Allah wills, the baby will naturally move into the normal position, inshallah. Additionally, right before delivery, a doctor might attempt a special technique to manually turn the baby into the normal position, but this should only done by a gynecologist. If this technique is used, delivery may need to happen shortly afterward. I hope this explanation will you understand how to interrupt your ultrasound report and assess your baby's position, inshallah. No more today. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel for get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.